Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great exercise for those of you with spondylolisthesis of L5S1. It's going to help you learn how to use the right muscles to hold that spondylolisthesis vertebra slightly backwards, avoiding pain and allowing you to work out and get into shape without aggravating yourself. Hope you enjoy. So, a great exercise to help you with your spondylolisthesis, especially at L5S1, which is your lower aspect of your spine, is to perform the straight-legged glute bridge by using the longissimus and iliocostalis muscles that are a part of your lower back. Now, these two muscles, their lower fibers, attach to the vertebra in such a way that they can exert a pressure that actually pulls that vertebra backwards. And there's a lot of people out there doing exercises for spondylolisthesis that emphasize stretching forward and abdominal work, knee to chest, and that's all great because it helps to temporarily stretch out the lower back, but it really doesn't do anything long term to help prevent spondylolisthesis pain, especially at L5S1. So this exercise is going to actually strengthen and condition the musculature in the back to exert a pressure backwards and help relieve a lot of that pain. We're going to engage our core by making sure that our alignment of our body is straight. If we have a tendency to hip hike, meaning have one hip come up more than another, lean our ribs down, twist to one side, we want to get our alignment issues set so we're dealing with a square body structure. Remember, at Pain Free and Fit, we're always emphasizing the need to have specific tailored exercises for your body, because otherwise you're just going to be strengthening the dysfunction with general tear sheet exercises that most people teach, especially when it comes to corrective exercises like for spondylolisthesis. So once our alignment is set, we're going to engage a core contraction where we pull our lower tummy in, engaging tension in our multifidus muscles, which are those small muscles on our back. We have a separate video on our channel you may want to subscribe to learn about multifidus action. And then we're going to exert a little tail under tension. Now here's the key, because during the glute bridge, where I squeeze my buttocks and lift my hips, if I don't keep the tail under tension, what's going to happen is the longissimus and iliocostalis muscles of the lower back are going to exert not only a backwards pressure, but also an extension pressure, a tendency to arch my lower back. And that can aggravate your spondylolisthesis. So by tilting the tailbone under slightly, you're going to hold the back, the arch of the back, flatter, and that's going to emphasize less extension, or bending, arching backwards of the back, but it's going to recruit much more of that ability to pull the vertebra backwards. So that's how you take a muscle that contracts and performs two functions and kind of deletes one of that function, which is to extend the spine. So we're going to keep that tailbone under, or pubic bone up. That's a roll of the pelvis, posterior pelvic tilt. And as I squeeze my buttocks, I'm going to raise them up as high as comfortable. If I feel any back pain, I'm going to increase the amount of tail under movement, or I'm going to limit the height that I go. I'm going to make sure my feet stay straight, avoiding external rotation with the leg. That's a big problem. Some people have one foot that turns out. That's going to cause hip hiking, or the hip to shift up. That's going to compress one side of my spondylolisthesis and overstretch another. So we want to make sure the feet are perfectly straight. We hold for a few seconds, and maintaining that core contraction, lower tummy in, multifidus contraction, and tail under tension, we slowly lower down. So you can hold these repetitions anywhere from 3 seconds to 10 seconds in the top position, and you're focusing on maintaining tail under tension. That's the biggest mistake, especially as you get fatigued. The abs are going to get tired, and that tail is going to want to pop up and arch the lower back. You want to avoid that. And by doing this, after a while, you may feel tension in your hamstrings, which if they get to be too tight or cramping, you can just straighten the knees a little bit. That'll engage your quads and take the tension out of your hamstrings. You'll feel the buttock get tired, but you'll also feel tension in your lower back, in that longissimus and iliocostalis, which is about an inch or an inch and a half to the side of your spine. You'll feel that tension in the back, and that's the muscle that we want to build up the strength on to help decrease the forward slippage tendency of the spondylolisthesis, especially at L5S1. These fibers of the longissimus and iliocostalis, they're especially designed at lower levels of the back. So this isn't as effective for people that have spondylolisthesis up high, let's say at L2 or L1, but L3, 4, and especially 5S1, these fibers in this exercise is especially targeted to help reduce that forward slippage. So if you like this exercise, we have many more on spondylolisthesis. Please feel free to subscribe to our channel. If you have any questions or comments, please leave them below, and I'll do my best to get back to you.